What's going on, guys? Today we're going to be talking about lower back pain and the exercises that you could use to help with your lower back pain. John the PT or my dad will talk about the anatomy real quick, and then we'll hop right into the exercises. So let's get started.
So trauma isn't always the cause of lower back pain. A lot of times it's prolonged positions, prolonged sitting, prolonged standing, prolonged bending. It could also be frequent movements that you're doing, a lot of bending forward, a lot of twisting, a lot of reaching. So one of the best things to do is perhaps identify the positions or the frequent movements that may be causing your lower back and cut down on those movements. So the bottom 5 vertebrae of your spine are the lumbar. They have a little bit larger bodies than the thoracic. They have joints just like other parts of your bodies, like knees and hips, but they're called facet joints. And from your lumbar spine, the facet joints are made so you can do things like bending forward and bending backwards. That's just the way they move. As I said, the facet joints are located behind the vertebral bodies, and they get more stress when you do things like, and there's a lot of ligaments in here that you can put stress on or tear that may cause you lower back pain. Around the front part of the vertebral body is the disc. Now the disc separates the vertebral bodies one from the other, and they have like a jello type material in the center of the disc, and then some cartilaginous matter that goes around the outside of the disc. And you can get tears in the outside of the discs, or you can get a larger tear and have some of the inside fluid leak out towards the back part of your nerve. So you can get out of bed in the morning and you could have a hard time bending, or you can get out of bed in the morning and you can have a hard time, straightening up, and that's probably from something that's going on in your lower back. So let's just say you were bending all day at work the day before, and you get up the next morning and you have a hard time straightening up and you're having pain in your back. So initially you don't want to push yourself past the pain. You want to give yourself a couple days of easy rest before you try to get the range of motion back. And you can do things like heat, some ice, change positions frequently, and do some easy walking to start out in your recovery process. Another thing that you can do is get yourself in a position to take some of the pressure off of your back, and I'll show you what that is. So one of the ways you can take pressure off your back is just getting an object, a stool, something else that's going to raise your legs up to be about 17 or 18 inches high. And what that does is it unloads your legs and takes some of the pressure off your spine. And so initially, when you're in a more acute phase and you're doing things like heat, ice, rest, a little bit walking, this will also help you take some pressure off your back. So again, now we're talking about a more acute phase, and let's just say you have difficulty standing up straight. So one of the initial things you can try to do is lay on your stomach. If you can't lay on your stomach, then you could start by taking a pillow or two and putting that underneath your pelvis. And perhaps that position will be a little bit more comfortable, and then you can work yourself down to a position where you don't need any pillows. And that'll help you get, when you stand up, that'll help you stand in a more upright posture. Okay, so now you're progressing nicely and you're able to stand up straight. And one of the exercises that you can progress to then is just coming up on your elbows and just staying like that for a little bit longer amount of time, maybe like a minute to 2 minutes. And then sort of the final progression to getting back your extension is putting your hands at your side, keeping your pelvis on the ground, putting your hands up here at your side, and coming to like a modified push-up position. So pressure on, then pressure off. And you don't want to push through the pain. So if this is painful, then go back to the up on elbows. If the up on elbows is painful, then just lay on your stomach. And this will help you get back some of your extension. So let's just say that you're able to stand up straight now, but you're having difficulty trying to bend forward. So in that case, we'll try to get back some active range of motion of your lumbar flexion. And one of the easiest exercises to do with that is a single knee to chest. And hold that for about 15 to 20 seconds. Let your body relax. If you don't have any pain with that, then you can put this leg down a little bit straighter, and that'll give you a little bit more of a stretch. And you can do that on both sides. The progression to this is to pull both of your knees to the chest at the same time. And that gives you a lot of flexion in your lower back. Sometimes you'll feel like your active range of motion of like twisting back and forth isn't there. So one of the ways that you can get that back is, again, laying in this position like this, and then gently moving your legs from side to side and opening up those facet joints of the vertebral bodies. As I said earlier, a lot of back injuries come from prolonged positions. And a lot of times your hips, your hamstrings, the muscles of your upper thigh will also get very tight, and that contributes to your back getting tight. So one of the exercises for that is a hamstring stretch. So you want to just grab underneath your leg and just let this back of your leg stretch for like 20 to 30 seconds each side. If you pull down on your foot a little bit, that's also going to stretch back here behind your knee. And what you do with this exercise is kind of get in this figure 4 posture, gently push down on your hip in this position. So you're feeling a stretch in your hip, knee, leg, okay? And then what you're going to do is bring the opposite hand over, and just you'll feel a stretch out in this area through here. So a standing exercise that you could do for lumbar flexion is just going over to your stairs and going up to the second or third step, putting your foot up on the step and just leaning forward into the step, bending your top leg and then keeping your bottom leg straight. So you're stretching all the muscles in your buttocks and your back on the one side, and your hip flexor and your calf muscles on the other side. So you get a lot of bang for your buck in this exercise, and I would do it 3 times each side for about 20 seconds. The way to do a back exercise for extension standing is just standing in one spot and leaning back. And you can do these throughout the course of the day if you feel like this particular motion is helping to improve your symptoms. So hopefully at this point in your recovery, you're starting to have longer periods without pain. You're able to walk and do most of your job without having pain. And you're going to move to some strengthening exercises so you don't re-injure your back. And keep your back in neutral and just raise your leg in front of you like so. And you can feel that working in your hip and pelvis area. Put a little more weight on the machine when you do that, where you're going to bring your leg over top of the pad and push it back without bending forward. And it works the erector spinae, lumbar muscles, and your hip extensors. So again, now we've progressed to strengthening exercises, and this is an abdominal strengthening exercise which takes some of the pressure off your lower back. And Chris is going to be in a flat back position when he starts this, meaning that his pelvis is going to be a little bit more neutral. It's not going to be arched into like a lordosis or a butt sticking out position. And from that position, from the flat back position, he's just going to bring his shoulders and his head up off of the pad until he feels his stomach muscles contract, and hold that for a second or two, then back down. And then a way to work the obliques in this same position is to cross your one hand over your other hand and then come up to the outer side of your knee on the one side. If this is painful in your back, it just means that you're not ready for this exercise yet. And then a strengthening exercise for your lumbar spine would be lying on your stomach and having a couple pillows underneath your pelvis. And then just start by raising your leg a little bit off the ground, keeping it straight and down, and then switching to the other leg, just like that. And you're not going to bring the leg up so high that your pelvis is going to come off the pillows. Both legs, both arms, and that's called a Superman exercise, and that's a very difficult exercise, so I wouldn't progress to that one until your back feels really good. A great thing to use for back pain recovery is a swimming pool. What you can do initially when you're fairly acute is just do some walking in the water in all directions, forward, backward, and sideways. And one of the ways that you can take pressure off your back in the pool is by using these floatable noodles. We're going to put these underneath Chris's shoulders, and he's going to bring it down a little bit till his feet are off the pool, okay? And I'm going to have him go into a little bit more of a vertical position. That means the other way, vertical. Relax and let your back sort of decompress in the pool. And you can do that as well as doing some bicycling. So do some bicycling, easy bicycling in the water, and then relax and try to decompress your back. Also in the water, you can progress to a great exercise that really works your lumbar spine a lot, and that is using the kickboard and sort of fluttering with your feet as your legs go up and down. They're going to work your lumbar spine. And this is a higher level exercise. If you have pain with this, don't push through it. But as you get better, it's a great exercise to keep your back healthy.
Thanks for watching. I hope this video has helped you. If you have any questions or comments, please leave them down below. For my current subscribers and viewers, thanks for your continued support. For my new viewers, just a heads up, my channel focuses on fitness, therapy, and training. So if you like that sort of content, please continue to come back. Yeah, and that's it. Thanks again, and I will see you guys in the next one.